Yes, Divya, we are live now.
Yeah,
So,
hello, good evening, Priya.
thank you so much, Divya, for joining us for today. And today we have with us Divya Kiran Rao. She's an EFT coach and she specializes in the field of diabetes support, how EFT can help us in diabetes. So, first of all, Divya, my question would be how like tapping get introduced in your life? Yeah.
Yeah, good evening, Priya. Thank you for this invite. Uh, I'm Divya, working as an assistant professor in nursing college, and right now pursuing my PhD also. And I have taken this as my niche because I have taken EFT as the complementary therapy for diabetes.
Okay.
Yeah. So I was having a dream of pursuing PhD, and I wanted to get into diabetes because that is one of the leading cause of NCD, non-communicable disease in India. Throughout the globe, it is, yes, but in India now it is one of the leading cause, and in the world we can say it is our country is in fifth position, fifth leading cause of the diabetes. And diabetes related complications, there are many that I will tell later on. So we have to work. There are many interventions were done, but still there is no much results for that. The nutrition therapy, it might be medications, it can be even the non-complementary therapies also. There are huge, but anything, there is no exact result. Sometimes it will be helpful, like yoga, meditation. All these are helpful to some extent, but not completely. I was looking for a therapy which will be much helpful. And by God's grace, in December 31st, when I was traveling to Bangalore, I saw a status in Elsa ma'am. And she's my guide in the sense I believe she's my guide because she has guided me a lot when I was working in Mahe Manipal as a research assistant. I'm in a research field. So when I was working there, she used to guide me for many of my research papers. So she had put a status like EFT. So I got a curiosity. What is this EFT? Then I started searching about the EFT and its related articles. So there were a huge number of articles where I was so much impressed. And later I started to search where can I go undergo this course. So one fine day I saw yeah, that same day itself I saw Akash Gursa's in Facebook. I wanted to attend the session and I had joined. So I was very much impressed because sir's therapy, that awesome. It is completely awesome. And really, I wanted to get into this field, and I came as such. And I joined in the month of January. So very nice, and so much of transformation in myself I can see, and also in my family members as well as in my clients, a lot of transformation. I'll say that journey and every this transformation stories in this session.
Okay. So, like as you told about the India is the at the fifth place in the diabetes, then what are the reason what are the causes that create this diabetes at such a level? Like there are stress. I know people are not following the right lifestyle. They are not sleeping on time. They are not having right habits. They are having so much work pressure. What according to is like creating so much of these cases of diabetes nowadays? And how can EFT
Diabetes is
support
one of
in the like healing of the people who are having diabetes?
Yeah. First, to tell about diabetes, we will not consider it as a disease condition. We say
Okay,
it as a lifestyle disorder.
okay,
Earlier, around 80 years back, if you are seeing the rates and ratios, incidence rates and all, it was very less. But uh, presently, when you see, like at present generation, we can see around 850 million people in India itself, they are having diabetes, and it is expected by 2050. that around 156, 7.7 million people will be having this diabetes based on the research reports. So the reason is mainly because of our lifestyle. You know, now everyone are into a smart work more than hard work. Earlier, our Indians were in a hard work mode, but right
Or
now
maybe
everyone are in a soft work,
or we
right?
can say physical
MNC
work was there.
companies, yeah, software companies you can see, and their lifestyle it has become sedentary, much of sedentary, and also the nutrition you can see. Earlier we used to grow, we used to eat our grown foods, but right now everything fast food because the world is fast. They won't have much work output productivity they see, but they give less importance to the nutrition. So you can see in the corporate cities and all, what they do early morning, they leave their home on the way itself. Any fast food centers are there, they go and eat up. In the canteen, afternoon, they eat up. And when coming back, any chats or any snacks, they will have it and they'll come back, they will relax. So this lifestyle is going on in many of the cities, and you can see the rates also in cities. It is more than the villages
Villages.
because village people right now also they are having the hard work. When our body is having that, we can say that yes, we can maintain even after like 50, 55, 60 years. They will get. We won't tell that villagers are not at all having diabetes. They will. Maybe it is because of hereditary or somewhat they will be having, but it will be late. But right now, when you are seeing in the metropolitan cities, the onset of disease is between the 30s itself.
Mm.
They are at when you see the HbA1c, almost around 30 people to 49 people, their HbA1c is around above 6.5, which is actually a borderline. We can see it, say it as a pre-diabetic. So what are the reasons? Mainly, we can say maybe because of their sedentary lifestyles, maybe because of their food
Diabetes.
habits. And the reason for all this is the stress. Yes, the main reason we can tell 50 to 60 percentage of diabetes is mainly due to the stress and stress related. You can see that stress will make us to have a procrastination. We feel lazy to go for the diet issues. We for the exercise or walk. It can be any gym kind. It can be, and also this stress leads to emotional eating.
Yeah,
We eat very much, and we always go for a junk food because that is easily
easily
available
available.
and fast. Now Zepto is there, Blinkit is there, Swiggy, Zomato, everything we can get it within minutes instead of cooking. So people are lazy to cook also. The reason mainly is the stress. So maximum people are having stress-induced diabetes, stress-related diabetes, and other reasons are also there. Maybe because of their poor lifestyle itself, majority of the people will be getting. But when we see the cases, I'm in a health profession background, and when I visit the hospital along with my students, I see majority of the patients are diabetics. When you speak, ours is nursing is related to communication. Okay, when we communicate with the patients, when we go deep into their uh, emotions, we will get to know that the stress is one of the main things. So, this made me to take this intervention, which is very effective. And also, there are a lot of clients who are telling that even having all the sweets. This is the season of mangoes and jackfruit, and doctors tell that don't eat jackfruit, don't eat mango, because that is one of the main culprit. You'll be having your HbA1c more. They say that even after I'm eating jackfruit, even after I'm eating so much of mangoes, my blood sugar has come down to normal. So that is one of the most satisfactory thing what we get from the clients.
And any result that you want to share that you may have experienced because of tapping that person was able to manage their sugar level and diabetes that has really like motivated you or inspired you and you was also like surprised that okay I didn't thought this technique would be so much effective, but that time you realize, okay, this is way more powerful than I thought.
Actually, before introducing to the people, I wanted to see it in my family itself. So my mother is a diabetic, and she was having too much of fatigue. So once the HbA1c level increases, our sugar level increases, we will be having that weakness, fatigue. She was perspirating a lot, and sometimes she used to get giddiness. Throughout, she was sweating and giddiness she used to get. And I wanted to try it on her. If I tell her, she will not do. That is for sure. And I don't have that patience to tell it in Kannada language, which I'm not that comfortable. So I wanted to have that result in her. But so what did I do? I did a surrogate tapping. Every day I used to do the surrogate tapping. And along with this, the color therapy, which was introduced in the sessions, I used to do it. So for 3 to 4 days I did, and I used to ask daily whether you are having giddiness today, whether you are having giddiness, did you feel that? So day by day she said, no, today I didn't have, today I didn't have. So when I got that results
Conviction.
in front of me, yes, I can see this in patients also, I thought. And when I was like to my colleagues, I used to do. And one colleague, she came, she said, you had put a status na EFT. What is that? I want to do it for my daughter. Her daughter was reluctant, but later she said that I want this EFT. So after you said all these things, I want this EFT because I'm a diabetic. So I took a session and it was very deep session. And right now she's saying that even after having all these sweets, all attending functions and having nice food, I'm not having more. My
Really.
blood sugar was 220 and right now it is 170. That was the first result which I got from the client. And I said, wow, it is really great. And then I started. I got many references. And even today I got one, like I keep on working on the people who have worked already. So when I asked her, she said like whoever doctor she visited, her diabetes, I mean the blood sugar was not at all coming down. It was more than 200 always, and her HbA1c is always, it is 9.7, 9.10, which is really great and which is risky also. It should be around 6 or 6.5 maximum, not more than that, and hers it is 9.7. So after giving this EFT session, just I took 2 sessions for her, but she's doing daily. That consistency she has maintained. Every day she taps for 10 minutes. I think she's tapping at night itself. So today she said, Madam, my blood sugar is 130. Uh, Fasting sugar is 135, and after the food it is 130. Really, it's great. See, 200 is somewhere and 130 is, it's
Mm.
completely different. And she said for around 12 years she's taking medications and her sugar level it's not coming down. Just with this tapping, I'm getting so much of results. And so I want to have that HbA1c, so I'm waiting for her HbA1c level. In short, I will get that result also.
And one thing which I have realized, Divya, that when we do tapping sessions with clients, then at the surface level, they may say that is the diabetes, but there must be some events, some trauma that they are storing. And when you tap and release those trauma, then automatically that get released from their body, and then they are able to take care of themselves because obviously people know what to eat, what to like, how their lifestyles should be, but they are not able to take those actions because something is really stuck in their body because of those events. And when we tap and go and release those emotions, automatically, I feel like they, as a person, change. So do you also realize there is a like a relationship between the traumas they had in their life because based on certain events and their diabetes or any other issues that they are facing in your life? Because I have found that there's a connection. If because your body is storing everything, you may forgot, but your body doesn't forget anything. So did you find any such correlation between your in your clients that you deal with?
Obviously, obviously.
Yeah.
So initially to pent up, they will not. They
Yes.
will say that I'm having diabetes. There is nothing such problem, they will say initially. But as they start to tap on now, they start to have
Yeah.
that rolling of the tears. And when you go on, the trust building is one of the main thing. So once they build, they develop, we develop the trust with them now, they start to release. The history is very long.
Yeah.
It comes from the childhood itself.
Yeah.
So all those sometimes the parents, they might not be knowing. They will show so much of love to their children, but their thoughts, their emotions, when it is not valued, it becomes a problem.
Yeah.
Many of my clients had those kind of issues. They showed love. They protected me a lot, but my emotions, my thoughts were not
Yeah.
valued. That things when it comes up, it will be storing in the cells. We can say our brain power is much sharp, but no, our cells are having million types of memory. Million
Yeah.
times it stores this kind of memories, which is very difficult to erase. They try to do it, but they cannot. Even if you go to a psychiatrist, if you go to a counselor, it cannot be released completely.
Yeah.
That is one of the thing mainly I saw, because one of the client, she had these issues and she had a fear of like men,
Yeah.
that also, and she had gone to psychiatrist, she took a counseling, she took medications for long, but these issues now, it was not resolved.
Yeah.
As and when we started to tap, everything it was coming out, everything it was coming out, and once she came to know, okay, these were the things that was stuck, then okay, I have to work on this, I have to work on this. Slowly, slowly, we started to work, and it was released, and right now it's okay.
Yeah.
So yes, it is like our stress, our emotions, which are deeply present, deeply rooted, that has to be found out, that has to be solved.
Yeah. And one thing I have also realized, like in the childhood, we are always like taught these emotions are good, these emotions are bad. But sometimes it is the reality of how I feel or any other person feel. We are not given that space of acknowledge. It is okay. I'm a human being. I can have anger. I can have sadness. But it is not like as per society's conditioning, don't be angry, don't shout, don't be sad. So maybe because of that we didn't get that space to release those emotions, and that is why it keeps on building. But now as I start tapping, and I realize the most effective tapping round are those where I allow myself to be angry while tapping, allow myself to be maybe sad, allow myself to feel certain emotions and then release. Because this is like it feels like now I'm being true to myself. So do you also think that sometimes labeling the emotion in anger, sadness, jealousy, that we have conditioned ourselves that if you are being angry then you are a wrong person, then sometimes it really like it feels like I want to be angry but I can't be angry, and that struggle really causes that in our body. And when I do tapping on that anger or that sadness, I feel like okay, it was the way I feel. It doesn't make me a good or bad person. And do the tapping, and now I'm like feeling very much relaxed and now able to focus on why it is okay to be angry, but what actions I should not take in the anger. So, what according to you, do you also realize that sometimes it is so important to give the space to the uncomfortable emotions as well? Because we have been so much taught be happy, be inspired, be like focus on the positive emotion is so much that we are not even allowing the space to be jealous, to be sad, to be angry, to be frustrated, because sometimes it affects us, but we are not even given that space to ourselves that okay. And one thing which I have realized, the tapping really works when we give ourselves the space to be angry, to be frustrated, to be irritated, and but while tapping, because without tapping, if you just get angry, sad, it is not going to affect anything. So how much role you feel like it is important to acknowledge these negative emotion or uncomfortable emotions that we are holding in our body?
It is very, very important. From childhood, we say yes. From childhood also, it has to be. Children will show directly.
Yeah.
They will show
Hmm.
parents sometimes they right now many of the parents they will be overprotecting their children. So most of the times children are allowed to do so because only one child I have. Let them show their temper tantrums. Everything is there. But earlier, lot of restrictions was there. So it was a huge family. They kept more on the discipline. So yes, that was piling up. And even
Mhm.
in the workplace, wherever they go, the adjustment issues, everywhere that emotions will be coming on. So we are not supposed to show there. What happens? It gets piled
Hmm.
upon. And from whom? From who, where, how to release those things? We may tell to our friends or some of our family members, but still, the trust issues. So many things will be there where sometimes they will not be able to tell it. They will be keeping, they will be suffering, they will be in a grief, they will be totally shifted. And day by day, it becomes a habit. If I'm today sad, I carry the same thing tomorrow to my
Mhm.
office or to my workplace, wherever. And the same again experience I feel, or my mindset is focused on that stress itself or that particular problem itself. When I overthink and overthink and overthink, it becomes a problem. Instead of that, meditation, it helps. Yoga, it
Yeah.
helps. But in a long run, one patient, one client, I can say she is very, very conscious about her health. Very conscious, like she goes for 1 hour of gym, 1 hour of yoga. Daily she does in the morning and evening. But if you see her diabetes, HbA1c, it is 10. She's not obese. She's very fit and fine. But whatever she does, she maintains her diet, she maintains all these things. But her HbA1c is not at all coming down. Because of this, she's getting urinary tract infections. She's having continuous respiratory problems. When you see the depth of her emotions, so much of things piled up from the child.
True.
Slowly, 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 when it is released, she got that relief. When that relief is seen, automatically she is feeling. Tells that I'm feeling very lighter now. Very
Yeah.
lighter I'm feeling. I was so heavy in my like my mind, in my heart. Right now, I'm feeling very calm. Some new perspective I can see. Another client, she came with the problem of chest pain, severe chest pain I have in the left side. I fear it is of heart issues. I said, really, is it of heart issues? Did you go for the test? Whether you did you do EEG and all? She said, everything I did, ma'am. Doctors are telling it is fine, and they have started with antidepressants.
Mm.
I asked, if you don't mind, there is a therapy called as EFT. Shall I do it on you? If you're feeling benefited, it's okay for me. I feel much privileged. And she said, okay, whatever you want to do, you do it, but my chest pain has to reduce. So when we started the sessions, one stories, it is coming out, coming out, coming out, coming out, coming out. So when we are storing it in very
Mm.
deeper, our emotions turn to negative issues and it turns into depression or anxiety or so much things that they go to a state where they want to end up their life also. So,
Yeah.
so much deep it will be.
Yes. Sometimes, one thing I now realize is there is a so much close association between your emotions and your illness. If you are just working on your physical things and you are not catering to your emotions, you may just feel temporary relief, but that problem won't get solved until you work on those emotions.
They
So,
have to
yeah,
acknowledge it. Okay, this is the things what it was stuck. Okay, this is my problem. That is why I'm having all these issues. When they come to have that knowledge, when they will acknowledge it, then they start to the transformation. That
yeah,
transformation is with the help of the CFT.
yeah. Like in
Yeah,
our physical surroundings, we need to keep cleaning every day, even our house, so that it maintain clean. But when it comes to our emotions, we didn't have done cleaning for so many years of like our life, like which I realize uh, for the last 30 years before Ho'oponopono and tapping, I didn't know there is a way to release these emotions as well. So that was just keep storing in my body, keep storing in my body. So now I realize, okay, even my emotions need everyday cleaning. So, So it is so important to release these uncomfortable emotions every day.
Yes, that
Yeah,
is true. It is very, very helpful where we can tap on this. Okay, today I felt so much anxious. I was really irritated. Come and tap for a few minutes. Okay, this is nothing. I
yeah,
can face the situation. I can have that confidence. Yes, these things are happening. People are like this. Fine, let them be. Let me focus on myself. My body is precious for me. Let me work on my things. So
yeah,
we develop that a new way of thinking where we can come out of those stressful situations which are making us suppressed or very hopelessness. Like there are a lot of situations where people will make, they will make suppressed, they will make you like hopeless. Or some situations like maybe other situations other than the work
mm,
experience, even in the social society people are there or the situations will be there which makes them to be so much to stressful situations our financial issues it can be, but when we work on our situations, when we try to tap and we try to acknowledge those feelings, obviously we can overcome those things. We can have that confidence. Yes, I can face that. That is the main thing. Instead of having a question mark, instead of being anxious all the day, you make it,
yeah,
try to tap, acknowledge those problems. You will get a solution. Like this is a self-help tool. Obviously, we know the answers than the
yeah,
another person.
true.
So we try to get that answer by tapping. So when this idea comes, when we are somewhat calm, when our mind is calm, we get new knowledge or new ideas.
Yeah,
When we are stressful, our brain works
yes,
very less. Yeah.
yeah,
So once we are calm, when we come to that state of calmness, we will be getting that ideas how to overcome those problems, how to release it also.
okay. So, Divya, now can we do one round of tapping with the people who want to use tapping for their diabetes so they can experience? Because what one thing which I have realized, when you experience tapping, only then you feel the difference. Unless and until you don't do tapping, you won't be able to experience the kind of magic it has. So, can we have one round of tapping where we are going to do tapping for this particular diabetes? How can tapping help in diabetes? Yeah,
Sure, sure, we will do. Okay, we will start with the current reality by doing the karate chop. Even though I am diabetic, I still choose to love and accept myself. Even though when people tell, hey, you're diabetic, don't eat sweets much, don't eat that, don't eat this, and I feel very low, but still I choose to love and accept myself. By listening to the word diabetic, by seeing my reports of HbA1c, I feel really anxious, so much of worry about my future and its complications, but still I love and accept myself. At the point, this diabetes, the HbA1c, what I'm checking, the blood sugar level, always it is showing at the higher level. Thinking of this, I feel really, really worried. So much anxious. And on top of that, my family members are telling you're diabetic. Take care of your diabetes. Have a control on your sugar. Do the exercise. Go for a workout. Have control on your food. Always these restrictions, always this words are making me get so irritated. So much irritation, and on top of that, the fear of the diabetes complications. It may affect my eyes, it may affect my kidneys, even it may affect my nervous system because people who are with diabetes they develop so many complications. I fear of my future. If I get these problems, who is there to look after me? Thinking of all these things, I feel really, really low. Whatever the medicines I'm taking, but still it is not working out. Thinking of this, I feel so much frustration. But all these are reality. I can do something so that my sugar level may come. Always being anxious, always being fearful is making me stressful. And this stress is further weakening my body. I want to see my health status improving. Instead, it is getting weakened because of this overthinking. So from today, I decide I have to take care of myself. I have taken care of my family. All these days, I have taken care. I had given importance to my family more than anything. But from today, let me take care of myself. Let me love myself. Maybe my body was speaking to me that, see here, I am getting weaker and weaker. You have filled in all the negative emotions in my body, and I'm really fed up. Maybe these are the words that is coming from my pancreas. That is why my insulin is not working properly. And that is why my sugar level is increasing. I will work on my emotions. I will release every negative emotions, and I will clean my body from all these negative self-beliefs. And I trust my body's process. Yes, it can heal it. Whether animals do take medications? Not at all. Then why should I depend on the medicines? The universe has given me such a beautiful soul and body. All these days I have punished, and not from today. I will keep my body as my temple, and I will keep it so clean, which is very, very purified, where my cells starts to rejuvenate. And I can see my blood sugar level coming to normal because I am at peace. I am at peace and I am calm. I am stronger and I can heal myself. My body, my cells can heal itself. My body has so much capacity to rejuvenate, and I can come out of this problem. I can be healthy, and I am healthy. Today, I take this affirmation that I am healthy, I am stronger, and I am at peace. I can see my sugar level in a normal state, that is 120, and HbA1c at 6. I thank universe for giving me such a beautiful opportunity to survive, and I'm ready to transform myself, and I acknowledge it. I am strong. I choose to love and accept myself. I really choose to love and accept myself. Thank you. Thank you. Thank you. Yeah.
I'm feeling very much lighter. Like it is sometimes we take our health for so granted. Even
Yeah.
if we are not having any disease, but still we take our body for so granted. and
Yes.
how much important it is to take care of our health and especially our
Very,
emotions.
very, very, very important. You know, the
Mm.
a book written by Louis Hay.
Louise Hay.
So beautifully, she describes that when we think that our life is not sweet, my life is not sweet, always I'm in a grief. So much of the times, the grief which has been stored in our body, the cells absorb it and it gives it to pancreas. So there the pancreatic cells, the beta islet Langerhans cells, we say this will release the insulin, and initially this starts to, like, the pancreas starts to get inflammation, and then the insulin resistance will be developed. Now coming, is it okay if I tell between the stress and the diabetes how it works out?
Sure, sure. And in
Yeah,
the last weekend, I can do one round of tapping on stress so that it can help them as well.
yeah,
Yeah,
yeah, sure.
sure, sure.
Usually how this process takes place is when we are in a stress. So sometimes stress can be emotional stress, physical stress, and sometimes it can be acute or sometimes it can be chronic. Acute in the sense it is for a short period. Maybe I'm facing exam, I'm facing an interview. It is for a good sake. We have to get ready for that. That acute phase is there where sudden flushing symptoms, everything we get, and when we prepare and at that moment it closes, there is no problem. It is for our good sake. But when it is for a chronic period, when I'm taking the stress for a longer period, maybe family issues it can be, or maybe it can be the work life pressure it can be, or adjustmental problem it can be. When it is there, then slowly this stress starts to work because we have a connection between our
Yeah,
mind and body. The mind body connection is so powerful that actually, even educated people, they doesn't believe this. One client came, what this, like one of my colleagues, doctor, she said, what this lady is speaking about mind, mental things and all. I don't want to. So such people, even they are highly qualified, they don't believe those. There is a relation between our mind and our body. The neuroplasticity, all those things are there where neural network itself changes based on our thinking pattern. So when the stress is there, our HPA axis will be affected. So it is hypothalamus, pituitary, and adrenal axis, we say. So when this is activated, the first thing released is the cortisol. So when the cortisol is released, that is one of the process where it tries to protect our body from the stress. When we have a stress, you can see we will be getting much loss of mental energy, even the body energy. We'll be in a very fatigued, tired state when we are in a stress level. So this cortisol, it tries to increase our energy by releasing the glucose. So our liver will be releasing the glucose, which is like usually carbohydrates will be releasing the glucose, but when the stress is there, cortisol will make an artificial release of glucose initially. So this will cause increase in the blood sugar. And also in a long term, what happens, the cortisol slowly starts to affect the pancreas, and this pancreas will start to get inflamed. So when these inflammation reactions are there, when the cortisol level is increasing, automatically we can see there is muscle weakness. We start to lose our muscle tone. Protein is lost from our body, fat is lost from our body. But still the glucose is rising because the cells has to take up the insulin to convert the carbohydrates to the stored glycogen. That will not take place here. Instead, insulin resistance will take place. So all this is, the main culprit is the stress. So when we treat on the stress, the cortisol level will be coming down. When this will come down, automatically we can see that our blood sugar also will come down. So likewise, there's a lot of correlation between the stress and the diabetes. Many of the people, youngsters right now, they are developing. It is not because of their genetic history or family history, anything. It is purely because of the stress. So 30 to 49 years people who are developing, within 1 year or 2 years, if they are focusing on this EFT tapping, automatically they can come out of their stress. They will know how to tackle this stress and all. They can be out of this diabetes condition or diabetes diagnosis, because our India is fastly moving to enter the fourth or third rank, because a lot of people are getting diabetes now. Mainly, it is a lifestyle. We have to know how to manage our stress. When we manage our stress, automatically we can control the food pattern, what we are taking. Automatically, we will stop to have this procrastination, and we can change the perspective of our thinking or handling the situations.
And even like in the research, it has been shown that EFT helps us to reduce the cortisol level, basically the stress
Yeah,
hormone. So even if
yeah,
you are not having diabetes, you just want to manage your stress in a better way, then do tap and release. It will really help you to manage stress in a healthier way.
yeah. There are a lot of research studies. They say the patients who underwent this tapping, 37 percentage of their cortisol level has reduced. So, so nicely they have got the results also. Even we can see in our clients also, they
Yeah.
are coming out of this stress. They are cheerful right now.
Yeah. Even we can, I think, first, as Akash sir always do, first do tapping on ourselves. And we can see the difference
Yeah,
in the way we handle things. Because
yes,
without tapping, I was a different person. I may have handled that situation in a more like a complicated manner. But now, because of the tapping, I'm able to handle those situations in a much more calm and peaceful way instead of being impacted by those emotions. So that I think
yes,
first difference you will see is in yourself when you start tapping. After a
yes,
certain point of time, people going to come and ask like, "What are you doing different?" Because we are seeing the difference in your energy. So what you are doing? So you may have
yes,
experienced that
sure.
people are coming to you that there is something that has changed in you. Any experiences of
Yes,
that?
first of all, I can share my experience itself.
Yeah.
I had for 11 to 12 months of headache, persistent headache. If I get a headache, either I have to sleep or I have to take a medicine. Otherwise, I cannot sit, I cannot listen to anyone. So severe the headache was. And in one Akash sir's class, evening it was, when I was tapping, it was completely within 5 minutes, the headache
Mm.
was stopped. And after that, till now, I didn't get. Till
Okay.
now, I didn't get that headache. That was a huge transformation, which yes, I have to do this. I have to be a coach where I want to see this transformation in my clients. I had made a goal. Yes, I want to be a coach that time. So
Yeah.
that huge difference I had seen myself, and also the changes in my like the transformation in my way of thinking. It can be way of handling a lot of stressful situations. It can. I was in stress. Like I was aiming for my PhD at that time, and even after having a lot of hard works, I couldn't get into it. So that stressful situations will make us in very different angle to think everything. It will be different. So this EFT helped me a lot. And to say about my client's experience, I said like chest pain. She said one of the client. So she was completely low, completely negative. She was even to an extent that she wanted to end up her life also. So, but as and when like 4 to 5 sessions I had given for her, she had worked out on that. And right now, like her friends used to say, "Why do you speak like this? Why are you always negative?" Then after this session, right now, their friends are asking, "What made you to change like this?"
Yeah.
Yeah, that complete, it is shift.
Yeah.
A coin is turning flip flop like that. Completely, she was negative, and now she knows how to handle the situations and how to be in a positive perspective. She knows how to handle it. So
Yeah.
that is the thing.
And one question mostly maybe people must have been asking you, how long or for how much time period of time we should do tapping? As my answer is like as long as you live, because the cause of stress will keep changing. It is not like ki that like you won't ever get stressed, because the situations with time change, because you are trying to grow in your life, you are trying to manage different things. Maybe today is some other reason, tomorrow it will be another reason. So as far as there is a life in stress, you need to tap. What is your take on that? How long we need to tap?
How long in the sense we like I tell every my clients, consistency is one of the main thing what
Yeah,
you have to follow if you want to be in a positive state.
yeah,
So they are so much addicted to this EFT in the sense every day they tell we are tapping.
yeah,
Every day I'm tapping, ma'am. Whenever I think, okay, I have got this problem, I'm in this pain, I am tapping daily for 10 minutes. They tap
yeah,
and they will tell that I'm releasing. I have got complete relaxation from that things
yeah,
and I'm okay. So when this consistency is maintaining, when they like once the tapping is so simple that they will get to know like how to handle, how to move on with the scripts like negative round, hope round, and then the positive round. They will try. They will imagine, okay,
yeah,
like this I have to do. And they will tap. Like many people, they didn't ask me. Initially, what is this tapping? Really, it works out. They will have that question mark. But as and when the first round, when you show that magic, they will come now. They will start, okay, it is like this. Okay, oh, really? At the end of that transformation, ma'am, you really made it. You really made it. That things
yeah.
they will understand. They will learn in that itself. People are very clever.
Because
They will learn and
yeah,
they will have that. Right now, all my clients, they are having that consistency. One or two clients, they are not. But okay, fine. Majority, they are doing and they are getting the results. That is one of the main thing which I am feeling satisfied.
yeah. And one thing is like tapping is once you experience the kind of results, it is a kind of a positive addiction that you have a tool in your hand whenever you are feeling stress or any uncomfortable emotion. Then once you have that experience, you can't stop yourself because nobody wants to be in that uncomfortable situation where when they are not able to think clearly and they are not behaving in a proper way. So people are that much clever, we can say, or they really want to help themselves. Earlier they didn't know the tool. Once they know the
Yeah.
tool, they are really want to help themselves and the people around them. So
Yes, that is true. Because every time clients tell, see, wherever we go to our stressful situations, doctors will not give any kind of solution. Even they will not ask what is your problem.
yeah,
They will not have that patience to listen to our story itself. But this tapping method, it gives so much of relaxation, so much of calmness to ourselves. It is really one of the beautiful technique they will tell. So majority of the people have said the same thing. They have come out of the problems. That is the main thing we want. Anywhere we go, anything, all the therapies are good, but this is the best.
yeah.
Yeah.
And one thing I would like to request viewers that do follow the meditation, but along with that, do tapping because even
Yes.
medicines will give you the most effect when you are calm, when you are peaceful, when you are in the state of relaxation. So follow your meditation as suggested by doctor, but incorporate this routine of tapping along with that, so that if you are holding something from your past or anything that is in current reality that is bothering you, it will get released, and so that medication can work on you on a more effective manner. So do tapping along with following your doctor's instruction.
Yes, that is sure. Doctors' medications are very important, but also we can see that when this stress is reducing now, the clients has reduced their medications.
Yeah,
They have mentioned, yes, they have mentioned, I have stopped one medication now because my blood sugar has come down. So initially, we won't tell that don't take medication, go for tapping itself.
yeah,
No, you have to go for medications. You have to follow the lifestyle like a good nutritious food, healthy activities. It is must. Along with this, manage
do
your
tapping.
stress.
Yeah,
So manage your stress with the help of this tapping. Meditation, it is good. Yoga, it is good. Out of all this, do this tapping also. So
yeah,
you get maximum results with this. So when they will come to know, they do this tapping because this is much easier than all those things.
Yes, and it's like I think in one of the session I attended that we always have our body with us, so we don't need special uh, kind of
Yeah.
instrument for this healing. Just do tapping on your meridians and see how
Yeah.
you change. So now I would like to do one tapping down on stress. So whatever is causing stress, let's do the tapping.
Yes.
Even though I'm so stressful,
Yes.
I acknowledge how I feel.
Yes.
Even though there are so many things about which I'm stressful, I still love and accept myself. Even though I'm not able to let go of this stress, but now I give myself the option that I can release it. Eyebrow point, this stress in my body.
Yes.
All these situations that are making me feel stress.
It's stressed.
All this stress that I'm carrying in my cells.
All this stress.
All this stress in my life.
Stressing.
All those situations
It's
that are making me feel this stress.
stressed.
Now just think about the situations that are making you feel stress. Just think about that. Maybe it is related to your health, career. Just keep thinking. Let your mind have all those thoughts that are creating the stress. It is okay to have these thoughts. I give myself permission to have these thoughts, and I choose to release this stress from my thoughts. I can let go of this stress from my body. It is safe for me to release this stress. My body is safe. I'm completely safe. As I release my stress, I get that clarity that what actions I need to take for the situation because of which I'm having this stress. I release this stress from each and every cell of my body. I release it from my subconscious. I'm safe. I'm protected. I'm calm. I'm relaxed. Now just take a deep breath and slowly exhale through your mouth. So it's
Very nice.
whenever I do tapping, I feel like okay, everything is taken care of. Yeah,
Yes.
truly.
That is
So
true. We can come out of this once relaxation we
yeah.
get. Yes.
And one thing which I have like read in one of the book that it was like our fight or flight response get activated because we have been conditioned for so many of generations because from the like from the animal life to this life we have evolved, but that fear of being attacked. Now there was a fear of animal. Now there's a fear of people will criticize me. people will dislike me, they will hate me, or they are going to judge me, they are going to reject me. And we are so scared, like it is really a tiger that is running behind us, or there's a some animal that is going to attack us, because this is how our mind has conditions. So it really help us, like by tapping we can calm down our amygdala so that we can see there is no danger out there, I can handle this situation.
Yes.
Yeah.
Yes, that's what. Whenever we are facing the stress, now immediately the sympathetic nervous system gets activated. That's where the epinephrine and norepinephrine releases. That is the main function of fight or flight response.
Yeah.
So when this is activated, where we will be usually fight response is very rare. Flight response is usually done by all. We want to escape from the stress.
Yeah.
What we do? We go for a walk, we sleep. Obviously, that some techniques, walking or listening to music, it helps in relax, but sometimes
Yeah.
people will store it.
Yeah.
It will be stored inside the body, and this makes short term we cannot, but long run when it is seen, obviously any part of our body will be getting affected. Some situations we don't want to see, then obviously within a year or 2 years our eye will be having that problem.
Yeah.
So the vision will be getting affected, always will be having the red eyes. You can see the mask like thing appears on their eyeballs. So those things will be seen whenever we are having this flight response. Whenever the flight response is there, this health issues will be occurring because of that.
Yeah.
Fight response, yes, we win or lose, we are facing it once or twice, we have this fight response, we will get that courage to face the new situations. But as and when a person starts to adapt for this flight response, they will develop the health issues for sure.
Okay. So, and like as we are closing the sessions, any suggestion to the people who are like having this diabetes, that uh, any tips from your side that can help them manage their diabetes in a much more healthier way? One is tapping. Any other suggestion from your side? And it is one of the most important thing. Yeah.
Obviously, diabetics, they have to take care of their health because complications are very much. But I'm not making them to stressful situations once
Mhm.
again. But obviously, diabetic neuropathy, diabetic retinopathy, and nephropathy. These are the three main complications where they have to take care of. And the diabetic wound, the diabetic foot ulcer, which we say that are the most common. Once it is developed, it is, my God, very, very complicated. We see they lose their toenails, they lose their foot, they lose even their uh, knees also. So knee amputation. Those are the complications that have to be faced in the future. When you see such patients now, if you dig on their problems, it is their emotions itself.
Yeah.
Majority of the times, their emotions. And initially itself, prevention is better than cure. When we know that yes, our HbA1c is 6.5 or 6, we have to manage at that time itself before the medications. That is done purely with the help of EFT and meditations and yoga. Yoga acts very, very helpful. If consistently 3 months of yoga is done, we develop a habit where we will not leave that. That is one of the things. Yoga, if we have that now for 3 to 6 months, one of the best techniques which, our Indian system very nicely they have done. Yoga is most beneficial for the people. Initially, identification of diabetes is very, very important, and they have to work on that. And obviously, the food. Like many people are having oats, many people are going for intermittent fasting. It may help to some extent, but there is no 100% guaranteed results. Eat your local foods. Local grown foods is very, very important, which will be making their gut healthy. That is one of the very important issues. Gut health is correct connected to our brain health. So keep your gut clean. Gut clean in the sense you have to eat the local food. So consider in my village, what in my city or in my particular area, what it is grown commonly. eaten fruits or vegetables or rice or bajra, whatever it is, that has to be eaten. Oats is not of our country's food. I won't tell it is completely negative, but give importance to the local grown foods. Your nutrition plays very important role for your gut, and the absorption of all the minerals or all the nutrients are in the gut itself. And your gut is healthy, your brain is healthy. So that is one of the take points. And yoga obviously very benefiting therapy. Obviously, EFT is one of the best technique we can tell being
Yes.
an EFT practitioner.
Yes.
And yes, once after you have diagnosed with diabetes, follow the medications, and every 3 months go for a HbA1c test. You have to uh, see the kidney functioning. That is one of the main, because diabetes people for a long run, after 5 to 10 years, kidney, they will be having some issues. So better to have a regular follow, better to have a consistent EFT tapping. Your stress is reduced, maximum complications can be reduced. So all your emotions will lead you to have the physical issues. That is one of the 100% uh, guaranteed thing we can tell. So majority of our physical issues is due to our emotions or our problems that has been suppressed. Work out on your emotions, release your emotions, try to be healthy as much as possible, and be having a positive mindset. That is one of the main things.
So thank you so much, Divya, for joining for the session and sharing your insight about how tapping can help us in managing diabetes in a much more healthier way. So those who want to connect with Divya, I will share her details in the description. So do check out the description. And once again, Divya, thank you so much for connecting and sharing your insight. It was really wonderful talking to you.
Thank you so much for this invite. Thank you for giving me an opportunity also. And people who wanted to connect me, you're most welcome to this healing world. I'm there to help you all.